Okay, Bismillah ar-Rahman ar-Rahim. Today our talk will be about disorder. First, before I want to clarify some question from the last visit, from the last lectures, that about the difference between bipolar depression and unipolar depression. So when we see a patient who has depression, we need to know if this part of bipolar or just unipolar depression, because unipolar depression, like you see here at the bottom, they call it major depression or unipolar depression. They come in episodes. So you have episode of depression, then you get better with the treatment or on your own, and then you get another one. But you never had a manic phase or hypomanic phase. So we call that unipolar depression or major depression. While bipolar depression, as you see in the above, is where it's episode, where you have depression and another mania and depression. You might have 6 episodes of depression and 1 mania, so that will be bipolar depression, not unipolar depression. So if you have any mania or hypomania, it will not be named major depression, it will be named bipolar depression. But if you have no episode of mania or hypomania, it will be called unipolar depression or major depression. Let's start on our lectures today, and today we're going to talk about the psychosomatic disease, which came from the Greek word. Psycho means the soul and soma means the body. So psychosomatic is a branch of psychiatry that look about the relation between emotional and physical health. So most people, for example, when they get tired, emotional, they might have depression, they might have GI side effect, they might have migraine, they might have asthma. All of that, we call them a group of psychosomatic disease. That's been the disease that is directly related to the stress and the emotional feeling. They are very common, hugely common in the whole world. They are kind of like when you convert your emotional distress to physical symptom. So when, for example, when a woman is stressed out by her husband, she will say, I have migraine or back pain. This is what we call like psychosomatic disease, converting this emotion to a physical symptom. And we have this for all the time, like when we have pain, we look at pain as a threat to our body. We use the same system, the amygdala and the emotional system, the same system that we use to protect us from the lion and escape from the lion is the same symptom that we use when we look at the pain. We start focusing on it and we start having different sensation and we start seeking reassurance that this pain will not kill us like the lion is. So what happened is there is a correlation between the digestive system and the brain, because as we said in the last session about depression, that most patients with depression come with physical complaint. Why? Because the GI system is the battleground of our body. So when we have pain in our GI system, stomach or colon or any part of the guts, these systems activate the fear center in the brain. And activating the fear center in the brain will activate or increase the pain. So we call that a vicious cycle. So pain in the guts increase anxiety, anxiety increase the pain, and this is what we call the vicious cycle that patient got in, and we need to clear that cycle and try to get rid of anxiety and the pain at the same time. That's why most patients respond well to antidepressant by decreasing the pain. Like we have a medication, a group of medication called SNRI, like a medication called duloxetine and milnacipran. Those medications are both for pain and depression. So you see patients taking them for back pain and also for depression. So that's why there is a huge correlation between the mood and the pain. So when we are depressed, we are less resistant to pain. So we have lower pain threshold when we are anxious and when we are depressed. And pain usually increase that emotion, and emotion increase the pain. It makes us in hyper-arousal situation. And usually here, as we mentioned, that the pain is a signal that comes to the thalamus, and the role of the thalamus is to send the signal to the frontal lobe and the amygdala. But the frontal lobe, if we are well educated, well relaxed, good, able, or we are able to tolerate our emotion, then the frontal lobe usually is the part of the brain that tone down that anxiety and decrease that anxiety feeling by controlling the amygdala. While depressed patient is the opposite. When the depressed patient feel pain, the amygdala kind of exaggerate that pain, and the frontal lobe will not be able to adjust the noise of the pain, and we feel depressed. That's why antidepressants work for both pain and anxiety and depression. So why we get sick? We have what we call the sick role. When we are sick, then it will help us unconsciously in a way that when I am sick, then there is a lot of obligation I will not do. Let's see, if I want to do this lecture for you and I feel depressed or anxious, I can call Dr. Yaqinuddin and apologize for doing the lecture, pretending that I have headache or back pain or anything. So sick role can sometimes protect you from a lot of obligation and make you have less duties, because people look at you as sick and you need help, and then you get out of many roles that you're supposed to do. So this is a legitimate reason for not fulfilling our normal emotion. So whenever you ask your wife to do something for you, she will say, I have headache or I have pain, and that will be an excuse for her not to do anything. And the same thing for men. The wife will ask him to do this and that, and he will say, no, I have headache and I have back pain and I didn't sleep, and all of that. Now, psychodynamically, we look at pain and illness as a defense mechanism. For example, if I have done something bad and then I feel guilty about it, so when I have pain, I kind of punish myself for being bad. So we look at pain as punishment, because I deserve this pain because I did something bad, and when I have pain, I feel like I'm having this pain to punish myself for that guilt. So we call that defense mechanism undoing. So undoing is when you try to correct something you did and it was bad. For example, undoing, let's see if you have attacked your wife or abused her the night before or said something bad, you take her for a nice romantic dinner. That nice romantic dinner here is undoing for the problem or the word you said to her the night before. So you are trying to undo what you did. Same thing, when you are in pain, you undo your guilt feeling that happened to you many years ago because you did something wrong and you feel like you deserve this punishment. So pain is kind of like the punishment you deserve for what you did. Here is the guy who cheated on his wife or did something bad, and he brought her very, very big rose to in the past. So we look at somatic symptoms as a undoing for the guilt and the anger about the punishment they have. So I deserve this punishment because I did this. So pain is one of the issue we punish ourselves with. The other defense mechanism we use when we are in illness and pain is called regression. Regression is when you revert to immature behavior to express your emotion. So most patients, when they get depressed, when they get illness, they start crying, or they start calling their mother, or they sleep with your teddy bear. All of that because you are trying to revert to earlier stage of support. Because when you were sick as a child, your mom used to hold you, and you used to have a teddy bear, so you kind of go back to earlier stage of development. Now, some people might start eating a lot or smoking a lot when they are depressed. Those called by Anna Freud is going back to the earlier stage of fixation, which is oral fixation. So when you see patient who is like developing cancer or any medical illness, and then he starts smoking and starts eating a lot, those patients we call the overeating and the over smoking. Those are, we call them oral fixated in that stage. When you get a little bit aggressive, this is what we call anal fixation. So these things you should have taken in the behavioral science, but if not, just we'll do it again for you. So the two defense mechanisms that we use in psychosomatic mainly is regression and undoing. I hope you understand these two very well. If not, I will try to explain it later. So we're going to talk about a group of psychosomatic, which is SSD, somatic symptom disorder, illness, anxiety disorder, conversion, and factitious disorder. So we're going to tackle all of these three today in this quick 40-minute or so. Let's take a statistic about somatic illness. It's about 16% of the population. So it's a huge, it's almost every one of us will have this symptom at some point in their life. Start with the first one. It's called somatic symptom disorder, SSD. Is very common in men and women. غالبا or most likely it was overlooked and misdiagnosed. So all of these patients who go to the GI doctor, to the family practice doctor, to the internal medicine doctors with different GI and headache, most of these patients have somatic symptom disorder. So this is what we call SSD. Let's take the case of Samia. Samia is a teenager, or she's 18 years old, female with a normal, healthy teenager. She did not have good bonding with her mother, but she lived well in her teenage year. Then recently, a couple of years ago, her father died. And we talk about the relation between the girls and the father, and we said the father is the main support for the young girls. So she developed a symptom of dizziness, migraine, and stomach pain. This is typical of SSD. So always there is GI and neurological symptom, GI and neurological. So dizziness and migraine is neurological, and stomach is a GI symptom. Now, Samia said these illness are very, very painful. She had excessive pain, and she is in severe pain that she is not able to function in her life. She is preoccupied with this pain all the time and always asks herself, why I am this way? Why I have to suffer all of this pain all the time? This pain always varies from time to time, but it has been going on for more than 6 months. So to diagnose SSD, the symptoms have to last at least 6 months with waxing and waning. So there's time where stress make it worse. There's time where less stress make it less. So Samia went to the doctor, and this is a doctor, and the doctor did all the lab work, all the x-rays, all the investigation, and she couldn't find anything. And unlike most doctors say, after they say there is nothing wrong with you, they will always tell them it's all in your head. So there is nothing wrong with your body. It's always coming from your head, means coming from your anxiety. We should not say that to patient anyway, but this is what the doctor said to her. It's all in your head. So Samia was referred to be seen by the psychiatrist, and the psychiatrist had diagnosed her with SSD, somatic symptom disorder, which is unexplained somatic symptom, which is very distressing and time-consuming, like Samia. The pain is usually always have to have 2 or 3 places: headache, neurological, dizziness, neurological, and GI symptom. And sometimes we have sexual problem. So it's always in the GI, in the sexual part, and in the emotional part, the GI symptom in the brain, like the stomach or the colon. These excessive anxiety arise all the time and make it worse when they are very anxious. She is very distressed about it, that it's not able to function in her job or find a job because of the pain, which is very traumatic and very overwhelming. And the pain has to last for 6 months. Why 6 months? Because this is the DSM-5 criteria, need to have it for 6 months. So it's a 5 month, it's not SSD. So the pain have to be GI, sexual, and neurological, unexplained by physical symptom. So he did all the lab work and all the x-rays and could not find anything. And it was lasting for at least 6 months. These symptoms persist and usually wax and wane. So there's time where they are worse, there's time where they are less, but they are all the time there. And as you know, when we have this symptom, we tend to be emotional and we activate our limbic system, because we said before that when we are in pain, our limbic system, our anxiety system become very active, and we worry a lot about the pain, and the worry increase the pain. So this is the vicious cycle we said between the pain and the anxiety. So anxiety trigger the pain, and pain trigger the anxiety, and Samia has been living in this circuit of vicious cycle, and there is no medical explanation. As you know before, that when we see a patient like Samia, we always need to look for a reason. We need to look for the root of this problem. What is the unconscious motive? We don't want to give Sandra just a medication. We don't want to give Samia a medication to help her. We need to get to the bottom of the problem. So let's look at what is psychology tell us. Psychology tell us usually that those patients who had GI symptom have problem with attachment. So when you see patient with a frequent GI symptom, stomach, colon, always look at the attachment in early childhood with the father and the mother. They tend to happen in patients with poor attachment to their parents, especially in the case of Samia. The loss of her father was really severe problem with attachment and the anger and the loss. So unhealthy attachment to other make you dependent by nature. So if you are not attached, or you lost your important person in life like your parents, then you become dependent by nature, because you don't have the cushion that you rely on in your problems. So become very, very anxious. You don't have many people to rely on during a crisis. So you become very, very anxious and worried, and the pain had increased because of that. So excessive worry, and you become very pessimistic because you don't have anybody around to help you. And always when we see patients with migraine headache, most patients who have a lot of migraine episodes, they tend to have anger problem. So they cannot suppress those anger. So probably here in the case of Samia, she has the GI symptom because she lost her father and she never had good bonding with her mother. And she has the migraine probably because she is very angry at the losing of her father. So she's angry at the world. And that anger can put you at risk of having migraine. So we know that Samia has SSD, mainly manifest by GI symptom and migraine headache and dizziness. And we said migraine is related to the anger she developed after the losing of her father, which was very important in her life. And the GI symptom was because she did not have bonding with the mother, adding to that losing her father at a very critical age. So Samia had lost her father. The father was the source of her good hormones or neurotransmitter in Samia. Samia, when she hugged her father and realized that he is there for her, she had plenty of oxytocin release. Oxytocin is the neurotransmitter that make us happy and relax and bond to other people. This is the oxytocin is the neurotransmitter that increase when you have bonding, like with your parents, with your fiance, with your significant other, with your kids. So Sandra has this oxytocin is like a lyric between the father and the daughter. Sandra had plenty of oxytocin hugging her father. The father has plenty of oxytocin hugging his daughter. And this is like a win-win situation for both. So when Samia lost her father, when Samia lost her father, she was deprived from that big source of oxytocin. And we say oxytocin is one of the good neurotransmitter that make you soothe. Soothe means make you relax, make you happy, make you unscared of the world ahead of you, make you feel safe about the future. So having the father was the source of that oxytocin. When she lost her father at this critical age, she lost a huge source of oxytocin that's why she developed this problem with SSD, which is the pain in her tummy and the headache and the dizziness. So this is the happy hormone or the happy neurotransmitter in the brain. So what are the happy neurotransmitters in the brain? They are the dopamine. We can talk about it next week or this week, inshallah. Dopamine is secreted when you eat, when you have good, relation with others, when you have sometimes use drugs. Endorphin or like regular morphine that we secrete our own when we are relaxed and happy. Serotonin, we said it may help you sleep and relax, and oxytocin. All of these, what we call the happy hormone, happy neurotransmitter. I'm sorry. Some people call it hormone, but they are happy neurotransmitters. And we need plenty of those oxytocin and endorphin. And the oxytocin and endorphin and dopamine in Samuel was coming from the father. The father being there, the father being the support system for her, not only the financial but the emotional and the safety net that he gave her was causing her to secrete all of these neurotransmitters that make her relax and happy. So early in life, when we have our parent, we develop these neuron that secrete these neurotransmitter, and they make us go through life with feeling safe and feeling happy because we have connection with these strong people around us that give us the safety net we need to fight through life. Our parents is the main support and the main reason why secrete these oxytocin and endorphin and dopamine. So Samuel was relaxed when she had her father around her, but losing her father really, so this is the hormone or the neurotransmitter that make you feel like you are loved, you are protected, and when you have those, you feel calm, you speak with very soft tone, you don't feel threatened. When you lose this source of neurotransmitter, like Sandra here, Sandra lost her father, and losing the father caused her to have activation in the sympathetic activities. So instead of secreting oxytocin and secreting endorphin and secreting serotonin, she starts secreting norepinephrine, got to be very active, cortisol level, norepinephrine. She was felt scared. It's like she is run down by a lion. So it is like the lion is coming to eat her now. The death of her father is like having a lion chasing her and losing the ability to find this lion. So she activated the HPA axis, and when you activate the axis, you become very sensitive. You are under pain. The pain will become worse, and you are in a very bad situation. You are threatened. You speak with a loud voice, and you become very agitated because it is exactly like somebody is chasing you. So when someone is chasing you, a lion or a giraffe or an elephant, then you're not going to talk slowly. You're going to talk very loudly to connect with people so they can come and help you. They also decrease your ability to fight pain, so increase your sensitivity to the pain, and any small pain become exaggerated because of that HPA axis. So the father was her support. The father was the one that caused her to have relaxation. When she lost the father, she started fighting and internalizing her feeling by having a lot of GI symptoms. Where is the battleground? The battleground always in the GI guts. The GI or the guts is where we find our emotion. So always our emotion manifests in the GI symptom, and this is what you call SSD. So SSD is when we have all of this emotion in our brain that we are unable to balance this emotion, so we present as psychosomatic disease. So one of the key treatment for Samia here is to have psychotherapy to teach her how to balance this feeling by learning how to be relaxed instead of learning how to be in the HP axis. So learning how to sleep better, how to think better, rather than activate her HPA axis. So we said we need to teach Sandra, instead of taking the emotion down to the GI system here, to present it to the frontal lobe, so we kind of have insight about what's going on. So one of the key issues in treating Samia here is to teach her a way to deal with illness or emotion in a way that it will not be through her body, which is the battleground, through her frontal lobe. So we teach her how to valence those feelings, how to journal those feelings. So you wake up, Samia, in the morning and you write to us what is going on, what kind of feeling you are going through, and we try to solve this emotion by using the frontal lobe, which is the piece of brain that God gave us to handle life and to deal with life as emotion, rather than handle it by just having a GI symptom. Like we said in Kamal's situation, the last case we saw last week. So Kamal, because his father, he had a father, but his father won't allow him to express those emotions, so he started expressing it in bodily feeling. Sumaya here did not have the father and did not learn how to deal with it rather than through her body. So always tell her in CBT, journal those feelings. Let's try to solve it in the frontal lobe. These patients are notorious for going to doctors. So they go to many, many doctors. They call that doctor shopping. They go to one doctor, they don't like him, they go to the other one, and they spend most of their life doing exam, physical exam, all of these lab work, x-rays. They get enjoyment out of the x-ray. They're trying to find something about their illness, and probably they feel more relief when you tell them that you have some illness, because that will kind of fulfill their emotion and fulfill their wishes that they want to punish themselves sometime for having this miserable life. So that's why they go to many doctors and see many, many physicians. So to summarize it, SSD or somatic symptom disorder is 6 months or more of non-delusional preoccupation with fear of having the idea that one has serious illness. So they go from one physician to the other, looking for a relief of the pain they have, because they have a lot of illness, and they exaggerate those feelings and make them frustrated and angry. So they misinterpretation of their bodily symptoms. So if they have little tiny pain in their stomach, they make a huge amount out of it, and they call ER, and they go to the emergency room for the illness, which is non-specific. And this is the clinical criteria. Patient, they believe that they have serious illness that has not been detected, so they go and see a physician. These persist despite conviction. For example, they go to the doctor, and the doctor do all the x-ray, they do all of the blood work or the lab work and tell them there's nothing wrong with you, and they go to another doctor and do it all over again. So usually they are accompanied by anxiety and depressive symptoms. It's very common in medical students. So, and it's okay, about 3% of the medical students have this. So most of the medical students, when they read about some illness, they think they have this illness. So you will have all of the illness of the GI symptom and the cardiovascular. Just by reading about it, it will open your ideas that, okay, I might have that, or I might have this. So this is very common in medical students, and it usually resolves after a while. Of course, most patients have what you call SSD, but you don't want to miss it, because sometimes it can really be an illness. Like sometimes it can be like myasthenia gravis, multiple sclerosis, lupus, AIDS. All of this can manifest in psychosomatics. So make sure that you do all the investigation to do that. And also we have to distinguish it from malingering. Malingering is when you have somebody who has secondary gain. Like a soldier will go and have GI symptom because he wanna get away from the war. So that will be called malingering, not psychosomatic disease. So malingering happen when you have really secondary goal. So you have secondary gain, clear secondary gain to get rid of that, to have these symptoms. The prognosis is usually varied from one to another. Usually you have to build a very good relation with the patient, because the patient will go to different providers. So the first thing, you need to make good relation with the patient so they trust you and listen to you. It has good prognosis if you are rich. Here, rich will make you better prognosis. If you are responding to the treatment with anxiety and depression, because we said most patients had accompanied anxiety and depression. So if the patient responds to the treatment of anxiety, that's been a good sign. If it happens suddenly, like your wife left you and you have this, so usually this is good prognosis. And if they don't have any personality problem with it. Okay, so treatment, as we said, social support is the main issues. Group therapy will help. Why group therapy will help? Group therapy, remember, most of these patients have this illness because they have abandonment fear. Like Samia lost her father. Kamal, his wife left him. So when you lose somebody important in your life, you have all of these GI symptoms. So group therapy, when you are connected to people around you in a group therapy, you feel like you are connected to some group that give you social support. And we say when we have social support, we have increase in oxytocin. That's why most religion will ask you to go and visit the friend who are sick. The Prophet said you always have to visit people in the hospital when they are sick. Why? Because when you are sick, you feel threatened, and having people around you will increase your oxytocin. Increasing oxytocin will decrease the pain and increase the pain threshold. So you might feel less painful, even if you have pain when you have people around you, because that will increase your oxytocin level, and oxytocin level will make you more relaxed, less sensitive to the pain. So you have to schedule them regular visit, because if you don't schedule them regular visit, they will pop in your office every day. So always give them a scheduled visit, like I'll see you every 2 months, and I will not order blood work or exam for you unless they are really needed. And of course, you have to build a good rapport with the patient. You know, most of these patients are introverted. So if you are introverted, you tend to have a lot of psychosomatic disease. So part of the therapy is to let the patient become extroverted, where they can express those feelings. So teach them how to express those feelings. Now we'll move to the other illness we're going to talk about. It's called illness anxiety disorder. Illness anxiety disorder is used to be called in the past hypochondriasis. Hypochondriasis is the illness, the old name for illness anxiety disorder. So let's see Laura. Laura is a young lady who always fear that she will have some illness. So she is 35 years old. She's unable to control her fear, and whereas she often believes that her symptom and sensation is a sign of serious illness. She always seeks reassurance from friends and from Google. She reads about this illness in Google all the time, and she is looking for to make sure that she is safe and doesn't have all of this illness. She always has symptom that is very vague and non-specific, and she wants to get a lot of exam to assure herself. So what is the difference between SSD and illness anxiety? In SSD, there is symptom, there is GI problem, there is migraine. In Laura's case, illness anxiety, there is no specific problem. She's just looking to see if she has a colon cancer. She is not looking to see if she has any illness. So the illness is not there, but she is looking to find that illness. So she needs in Google and make sure that she doesn't have that illness. And there is no medical explanation for the symptom. So in EAD, or illness anxiety disorder, you are preoccupied with being ill, but you are not ill. You don't have GI, you don't have headache, but you are preoccupied that you might have this. Maybe something wrong with your body. Maybe something wrong, how do you feel? Always you have a feel of despair and helplessness and hopelessness. Always have catastrophe about things that might happen. And you are always selectively attentive to that matter. So this is what happened to me. As a doctor, whenever I go to any place, they always start bombarding me with medical questions. Nobody have any illness, but they will keep asking you, what the treatment for this? What is about corona? Should I do this? Should I do that? So when I sit in any social situation, and this is going to happen to all of you, everybody will ask you about medical question, how we treat this, how we can prevent this. So patient or people are very, very anxious about having medical disease. So illness anxiety is about worrying about having any medical disease and being preoccupied with it to the point where you lost your life just looking for that disease. So, so in SSD, the symptoms are present. So I have GI. I cannot sleep from the pain in my abdomen. I have severe migraine. While in EAD, it's not there. Symptom is very mild or not exist, but you are worried about having that illness. Okay. Basically, it's always accompanied by anxiety. Most patients with EAD or illness anxiety have anxiety, have depression, have panic, personality disorder. Sometimes they have substance use. It's equal between male and female. So it can happen at any age, especially when you have any stress in your life or any pandemic like coronavirus. So always when you have any headache, you will say it's corona because you are worried about having that illness. Okay, the clinical feature is a persistent belief that we have a serious illness, but there is not had been detected. So you always go and do colonoscopy to make sure you don't have any colon cancer. So you do colonoscopy all the time, or you want to do MRI all the time. You have conviction that you have this illness, despite all of the negative lab. You still go into the internet, to the Google, and Google is the most things that make us very miserable, because every time you have anything, you just Google it and you start reading about it and you feel you have the illness. Before Google, we did not have a lot of this problem, but with Google now, you always can Google anything and you find an answer at Google. Also, the same prognosis, usually it's very good if you are high socioeconomical class, if it's sudden onset, if you don't have a personality disorder, and if you have good psychological support. So this is what makes it better. And this is the DSM-5 criteria. I will let you read it on your own. And you see this guy here, always Google account and finding what's going on in any symptom he has. So any symptom he had, he will Google it and try to find an illness. So he want to like tailor an illness for his anxiety. Now we're going to move to the most interesting part of our talk today, which is conversion disorder. Conversion disorder is very common, and it was used to be called hysteria by Freud. It is caused by converting psychological issues into physical symptoms in a dramatic way. Let me give you an example. So, Nancy, this is Nancy. Nancy is a young nurse. She is 27 years old, nurse, no significant medical history. She presented to the ER. She said, I have sudden blindness. So almost conversion disorder come with either sudden blindness or numbness or pain in the leg or the arm. This is the most common. So Nancy said she cannot see anything. And we did the fundoscopic exam and CT, MRI, nothing wrong with her. She's fine. Now, in her family history, she had a sister with juvenile macular dystrophy. Now, juvenile macular dystrophy will not make you blind unless you had for over 30 years. So you don't get blind over the night. So this is, not right for her. The onset of symptom always after discovering that her boyfriend wrote a romantic email to somebody else on Facebook. So she found on his Facebook page that he had written a romantic message to someone else. Of course, at that time, this is 10 years ago, we didn't have Twitter and WhatsApp and all of that. So it was Facebook at that time. So what happened is she sudden onset of blindness when she saw that romantic comment from her boyfriend to another lady. So always feeling very convoluted, always think about a woman things going on in love relations. So what happened with Nancy here, that the signal that she saw goes to the thalamus. The thalamus, our relay station, send it to the occipital lobe, then the amygdala. We say the amygdala is the first barrier that in our brain. The amygdala always is the part of the brain that get the signal first after the thalamus. And the amygdala realize here that if you want to convey this message to the frontal lobe and the brain will not tolerate this message. Why? Because it's devastating for her. It's like a death situation. So she has to use a defense mechanism like denial. And here is blindness is a way that the system is shut down. The amygdala said, we're not going to do anything. We're going to pretend that we cannot see. So here is psychoanalysis look at it as the unconscious mind trying to interfere to prevent damage to happen to you. So it's trying to protect you from that damage because your brain and your conscious level will not tolerate that feeling that her boyfriend is sending a love letter to another lady. For her, this is unheard of. For her, this is like way beyond our ability to handle. So it's like لا يكلف الله نفسا إلا وسعها. This is way beyond my Nancy's ability to tolerate, because she knows that love is deep in her unconscious mind, and destroying that love for her boyfriend will be devastating for her. She cannot imagine that to happen, because for her that man is a life or death situation. So the amygdala, knowing that, remember we said the amygdala is like your mother trying to protect you. She shut down the whole vision system, pretend that you don't see. Of course, because we said before that our limbic system comes first, always faster, and that's why most of our reaction in the limbic system. Of course, later on, Nancy will be able to see in a few minutes or a few hours, she will be able to see again, but it takes time for us to, this feeling settle in and try to absorb it. So that's why the amygdala wants you to absorb it slowly. So that's why she said, I cannot see. Later on, she was able to see, but the quick reaction by the amygdala is just to protect you from having this severe fear that can, destroy you. So the amygdala sphere first, then become the recognition. So why Nancy we said she took the lower road, sensory thalamus amygdala, instead of going to the cortex. Because if you want to go to the cortex, it will be very painful, we said. The cortex will analyze it, and when we analyze it, it becomes more painful. So she want to take the low road, so the brain will absorb it slowly and analyze it slowly, because the frontal lobe will do a lot of damage if it's aware about what's going on that quick. So taking the lower road is much safer here. Let's take another case. We have two immigrants. This has happened in Detroit in 19-something. I'm not going to tell you 1990-something. And we were like a resident at that time. And we have two immigrants, one named Salim and one named Selma. So Selma and Salim came to the US. Selma, as an immigrant, she was able to find a job in the clinic. Salim, being a foreigner and not having good English, he was unable to find a job. So Selma was working and Salim was staying home taking care of the kids. And for the Arabic culture, it's really very hard to accept that man will stay home and woman go to work. So this was devastating for Salim. Salim become impotent. Salim become angry. Salim become frustrated because he feels his wife is providing for him. This is very difficult for the man. Selma, on the other hand, because Salim is very upset, very angry, she also have anxiety and depression related to that. Because her husband is not happy, and when you live with someone who is not happy, you become unhappy. That's we said, when you have somebody who is unhappy, stay away from him. But because he cannot stay away from him. So one day, on the way to work, Selma had a minor car accident, like called skirmish. The skirmish is just tiny little bit. So it was not bad, and Selma said she has severe leg pain after the car accident. And that severe leg pain prevent her from driving. She said, even though it was very mild pain, it should not prevent her from driving. But she said, no, I cannot drive. So now Salim has to drive her to work every day. And this is his job, is to drive her back and forth to work. And that kind of resolution of the conflict. So Salma's unconscious mind create a conspiracy which is cooked in her unconscious mind to solve the crisis. That conspiracy is when I have this leg pain, which is very mild, I will aggravate it and make it a huge, so I can get resolving of the conflict I have with my husband. So she used her unconscious mind to solve the problem of her husband. Now the husband is having a job and he is happy, everybody is happy, and the emotional crisis has been resolved by cooked conspiracy in the unconscious mind of Salma. So Salma is trying to solve the problem by having this exaggerated response to the car accident. So what happened here is Salma was in an emotional problem, emotional crisis. She converted that emotional crisis into solving of the problem she had with her husband. So the unconscious mind is always trying to solve problem based on our conflict of the unconscious mind. The unconscious mind is always trying to protect us by having scenario and cook conspiracy to resolve the anxiety we have in life. John and Janet, on the other hand, both of them are married. They have been married for 20-something years. He's unhappy in the marriage. She is miserable in the marriage. So both of them are unhappy, but they are not divorcing. They are miserable, but they are not divorcing. No communication between them. So when the man and woman don't have any communication, then there will be no oxytocin. No oxytocin means you feel miserable, you feel very unhappy, because women rely on the oxytocin from the man. If the man does not say good word and connect good with his wife, she will not have any oxytocin and she will feel miserable. She will make his life miserable and the wife of the kids miserable. So always you need to take care of your wife. So what happened is every time Janet tried to leave the marriage, John will have severe pain in his leg, paralysis that he cannot move his leg. So when he said he cannot move my legs, Janet have to stay in the marriage to help John. So John is miserable, Janet is more miserable. Every time Janet want to leave the husband will develop paralysis. It means like inability to move his leg. So Janet have to stay with the marriage to be with him and help him. So the principle here is he is not deliberately making this pain and paralysis. It's just exaggeration. So Salma will not leave. So both of them want to leave one another, but both of them also want to stay in the marriage because they are unable to rely on themselves to be happy alone. So that's what we call marriage in the graveyard. Marriage in the graveyard is when you are married and your marriage is like dead marriage. It just, there's nothing going on in this marriage except headache and fighting. So we call that in psychology, marriage in the graveyard. That's mean your marriage is dead and you bury your marriage, but you're still alive and living near this marriage. So John have sudden happening of paralysis. Janet have to stay with him to take care of him. Janet want to leave the marriage, but in her unconscious mind also want to stay in the marriage so she can have somebody to blame. Because Janet, if she doesn't have John, she will not have anybody to pick on and throw all of her garbage on. So she want to throw the garbage on John. By staying with him, she will tell him, you are the reason for my misery. I'm staying here to help you. You are a bad person. I hate you. So she had relief of her anxiety by throwing this word on John. And John is happy listening to this word because Janet is not leaving him. So both of them is what we call bringing the worst in one another. This is very bad marriage, but both of them are staying in marriage for some reason. Not because of the marriage, but because Janet want to throw the garbage on him, and John will be happy to have Janet's throwing this garbage on him so she can also help him in his life. You know, if she will leave the marriage, she will not have anybody to find to blame for her problem. So Janet enjoy having John with all of his misery, so she can put all of her garbage, all of the problem on him. And that's what we call conversion disorders. That's why in marriage, please don't get to this level. Always try to solve problem before they get to the unconscious level. So here is what we call conversion disorder is having a motor or sensory pain, like John and like Selma, all over your body. Is not related to one specific. Like when somebody said, I have pain in all my arm, everywhere in my arm, that's really conversion. Why? Because you cannot have pain or numbness in the whole arm, because it's depends on the sensory nerve pathway. So you can have, like for example, numbness in the middle of the arm, but not on the whole arm, because every part of the arm is nerved by different nerve. So it's motor or sensory. Usually, let's see another example. Let's see I have a important person, let's see my daughter, and I get mad at my daughter and I want to hit her with my arm. But part of me doesn't want to hit her because I love her. Part of me is angry at her. So instead of hitting her, I will develop severe pain in my arm. So when you see somebody having severe pain in her arm or in his arm, that's mean he might have aggression toward his daughter or his wife. But that aggression cannot be manifest because there's part of you love her and part of you is angry at her. So you develop this pain as a defense mechanism so you don't hit her in your arm. So conversion disorder is broadly defined as the neurological symptom in the absence of neurological diagnosis. So there is pain in the arm, but it will not follow any specific diagnosis. It's very common. I will leave you the statistics so you can read it. And the psychoanalysis believe that it's an unconscious motive that you will hit somebody, but there's part of you doesn't want you to hit it, so you develop this pain in your arm, so you don't do it again. It can happen at any age, but it's very common in early adulthood and in the later in life. It's more common in the rural population because they don't have a lot of social support. It's more common in developed nation, and it's very common in military personnel as a way to get out of the duties, as we said. I will leave you with the epidemiology and statistic. Usually, conversion disorder is self-limiting. Most of it will resolve spontaneously. Mild psychotherapy, mild anxiolytic, hypnosis can help. Psychoanalysis can help to see what is the figure. I remember one lady, this will be, the last, let me give you the last slide and then I'll tell you about that lady. So factitious disorder is deliberate having problem to get something. So like for example, you will have broke your legs so you don't go to the military, deliberately break your legs, or deliberately putting something in your head to make you have severe pain so you don't fulfill the duty. So we call that Munchausen. And there is Munchausen by proxy, where a lady, we have one lady here in the hospital, she brought her kids for bleeding, and we did all the investigation, and we found out that she was putting a red dye in his anal, so it will show that he is bleeding. Deliberately, she is putting this red dye, so apparently he has a conflict with her husband, and making her son sick might bring the husband back to be with her. So we call that Munchausen by proxy, which is when you deliberately impose pain on someone to have some secondary gain. So the difference between SSD and conversion and factitious is conscious, is not unconscious, is with a premeditation motive. Now, the final example, and that will conclude, the final example I'm going to give you before we leave is there is an interesting story. There is a lady who had shoveling headache. So she had severe headache in her head. It is like somebody, it's like if you put a shovel and you hit somebody in the head, so it's like a sword pain in the head. It is like very, very sharp pain. And we found out through therapy that this headache is a way that she was fantasizing about the lady that her husband loved and she hate a lot, and she was fantasizing about the feeling that she wanna strike her with a sword, so she will have all of this pain. So that unconscious wish manifests in her as a headache, sharp headache. So once we make her aware of that feeling, the headache was resolved. So that will conclude my talk today, and I'll see you Thursday, inshallah, for interesting talk about addiction. Thank you very much, and I'm ready to have any question. Iyad and Munchausen, we said Munchausen is deliberate, means premeditated. Iyad is not deliberate, it is unconscious. Yes, exaggeration of the leg pain is unconscious. It's not in his conscious level. It's deep in the unconscious level, because that will solve a problem. That will secondary gain. Yes, I think you need to read about epidemiology. There is not much question about it, but please read it. Yes, it's very important. I can just ask, in convergence order, can they unconsciously be made to see the reason? Well, in the conversion disorder, you don't tell the patient is conscious or unconscious. You try to go with the feeling of the patient. So most of them will be about the wife or the boyfriend or the fiance. Once they talk about it, they will reveal all this information to you and resolve this feeling. So in Iyad, yes, they are afraid about having the illness. They don't have the illness, but they are afraid about having it. SSD, they have mild symptom, but they exaggerate the symptom to severe proportion. No, just read the slide. If you understand my talk, you will be able to solve all the questions. Just repeat the lecture, listen to it again twice or 3 times at the most, and you will be able to answer all the questions. There is no complicated question. I put most of my questions are very easy and straightforward. You are second year, I don't want to trick you, I just want you to know the basic. So just read about it and listen to the lectures, and that's it. So there will be a lot of questions about the diagnosis and how to differentiate between this and this. There will be a lot of case scenarios, which is straightforward and easy. Just enjoy the show. Psychiatry is things to enjoy. It's not a science, it's like an entertainment. Look at it, that's why I put all of these cases and all of this picture to show you that it is really an interesting field that you enjoy. It's not something like biochemistry or neuroanatomy, all of these things I hate and you hate more than me. It's very easy, it's very entertaining. So that's why when you listen to me, I hope you feel entertained and you feel loved and you stay with me, because this is what is psychiatry about. It's more about a human. And you need to be a good psychiatrist regardless of what is your desired specialty, because it's all about life, not about medicine. Thank you, and we'll see you on Thursday.